My name is Matt, and I am going to demonstrate an IV. I have all my stuff already set up. I have my IV start kit. I have a pre-filled syringe for a flush. I have gloves. I have the correct catheter, and I have my patient. The reason why we're starting an IV is we're going to be giving some IV medications later. Hey, how you doing? My name is Matt. I'm a nursing student. I'm going to start an IV on you. We're going to start the IV so we can give you some medications later on today. I had already washed my hands prior to coming into the room. I have my tourniquet, my tegaderm, tape, catheter, and flush. I'm going to try and start the IV in a site where the patient will still be able to do their ADLs. Applying the tourniquet 4 to 6 inches above the IV site. I'm going to go right here in the forearm. I have a 20 gauge angiocast. I have my catheter. Correction, my extension tubing. I'm going to flush my extension tubing. Get it primed and ready to go. Getting my alcohol. And clean my site. Circle. Concentric circles getting bigger and bigger. Here we go. Bevel up. Pulling tone on the skin. Inserting until I get a flash. Advancing the catheter. Popping the tourniquet. Applying the pressure. Pulling the needle. Connecting the tubing. Getting blood return, push, pause. Disconnecting, cleaning, drying the area off, applying the tegaderm. Then I'm taking this and I'm going to put my initials, the date, the size, and the gauge on here. And then I'm going to tape it up, secure it. Everything okay, sir? All right. And then I'm going to go back and I'm going to document again what time I did it, what gauge, length, site, how much I flushed, and that the site was okay, and that there was positive blood return, and that it was an IV start. I'm going to now demonstrate using a mini bag to give a medication. I have a 50 ml mini bag. I have my medication, which I'm going to be using vancomycin. I'm going to be giving 500 milligrams of vancomycin. I have my 10 drop set, and I already have my IV catheter in place in the arm. I'm going to wash my hands. I'm going to check the MAR to make sure that it is the correct dose for the patient and is the correct time to give the medication for the patient. I'm going to assemble everything prior to going into the room, the patient's room. once I have everything together and my MAR, I'm going to take it in the room, and I'm going to wash my hands prior to going into the room. And then I introduce myself to the patient. Hi, my name is Matt. I'm a student nurse. I'm going to be giving your antibiotic. I'm going to be giving you vancomycin, which is for the antibiotic. It's for super infections. So I'm going to draw up my medication using clean technique. I'm going to put my gloves on. Don't need gloves. Take my antibiotic. Check my medication, check it against the MAR, that it is the correct medication. There is, the concentration is 500 milligrams. 3 cc's is what I'm going to need to draw up. So I have my 3 cc's drawn up. I have my bag to add the medication to the bag. Going to dispose of my sharp. Going to mix the medication. Vancomycin needs to be given over an hour. So you're taking 50 cc's, dividing it by 60 minutes, multiplied by my drip set, which my drip set was 10. So it's going to be about 8 drops a minute. Going to prime my tubing. Okay. My tubing is primed and ready to go. Going to hang the bag here on the IV pole. I have a flush already prepared to check my IV site. At this point, put my gloves on. Clean the site, unclamp. I'm going to draw back. Got good blood return, so I'm going to push, 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 push. So my IV site is good. I'm going to take my tubing, connect it in. So I need 8 drops a minute, so I need 1 drop about every 12 seconds to get this in about an hour. Got it opened up and going. I would document which administration set that I would use. I would check it off the MAR. I would sign it off with my initials, what time it was started. I would check the site periodically to make sure that it is not infiltrated and that sort of thing, and then I would record the volume that I used to administer. And obviously I would use my initials. Alright, now we're going to administer a piggyback medication. We're going to be using the same medication, vancomycin. Same dose at 500 milligrams. We are going to draw up our 3 cc's again. So we're going to do all this prior to going into the patient's room. We have our 3 cc's drawn up, which is 500 milligrams. putting it into the bag, disposing of our sharp, mixing up our bag, and with this we're using a secondary set. It's still going to be a 10-drop set. And I was incorrect in my last one about it's going to be 1 drop every 7.5 seconds, so about 1 drop every 7 to 8 seconds. So we've got our bag. We're going to prime it, get it ready. Got it flushed down, and we are ready to go in the patient's room. We already have a primary bag going in the patient's room. So we're going to be adding this secondary line. Alright, we're going to go into the patient's room with the MAR. We're going to verify with the MAR that we're going to be giving this medication. Medication is a very, very strong antibiotic for super infections like MRSA. This is what we're going to be giving to the patient. We're going to verify the patient's name, date of birth. We're going to look at their armband and make sure it's the correct patient with the MAR. I don't believe I said that on the previous video, but we are going to verify this is the correct patient, and we're also going to look at the MAR and compare the MAR to the patient to make sure everything is correct. We have a primary bag already hanging, so we're going to add the secondary medication to this. We've got alcohol, we've got our secondary, but we're going to take the primary bag here, we're going to hook it up to this, and we're going to hang the primary bag lower than the secondary bag. We're going to leave the primary bag partially open at like a KBO so that it's just trickling in. We're going to hang the secondary bag, and we're going to connect it in. Have an alcohol. Clean the port. I'm going to add this in. And we're going to open this up. And again, 1 drop every 7 to 8 seconds. And it's going to infuse over an hour. After that hour, then the secondary bag, which actually is going to be the primary bag, is going to take over, flowing at that rate. We're going to go back and we're going to document on the MAR what time we started the medication, what time the medication ended. We're going to verify that there's no infiltration in the IV site. The primary bag was already going, so we could tell that the IV site was still a good IV site. We've palpated the area to make sure that there was no tenderness, and all the sharps were disposed of in the sharps container. And again, documenting everything that we had done and the client's response to the medication. Alright, we're going to go ahead and do an NG tube now. I'm going to look at the orders to make sure why we're doing the NG tube, whether it's going to be for suction or we are going to be actually giving any type of medication or anything through it, or we're going to let any of the GI tract rest. So I'm going to verify the orders in the patient's chart to make sure the reason why, so I can select the correct NG tube. I'm going to wash my hands before I come into the room, and then I'm going to introduce myself to the patient. Hey, sir, my name is Matt. I'm going to, the doctor's ordered an NG tube. I'm going to stick a tube into your nose, and it's going to go down into your stomach. We're going to let your GI tract rest. So we're going to be suctioning out your stomach and your stomach contents. Do you have any surgeries or anything on your nose that's going to be a problem with sticking the tube into your nose? What I'm going to do is I'm going to include one of your nostrils. Can you just breathe out through your nose? Good. Can you do the other side? Good. Alright, I'm going to go ahead and put my gloves on. We're going to measure out the NG tube. start at the nares, go to the ear, and from the ear to the xiphoid process. That's about the length, and then I'm going to need to insert a piece of tape to mark where I'm going to be putting it. I'm also going to get a couple of pieces of tape to be able to secure it. I'm going to lubricate the end before I insert. I feel like the rachnoid is the better one, so we're going to stick it in, advance it in. Alright, sir, I'm going to give you a cup of water. Go ahead and just start swallow, swallow, swallow. And I'm going to advance it as far in. I'm going to look in the back of the mouth, make sure that it's not cold up in your mouth. Can you say ah? Can you say your ABCs for me? Perfect. Verify that it is not in the trachea. The patient's able to talk. And now to verify, I may see stomach contents coming up the tube. What I'm going to do is I'm going to take my tummy syringe and with stethoscope, I'm going to listen as I inject air into the NG tube. Okay, I hear sounds in the abdomen. I'm also going to draw back, and I do get stomach contents. I'm going to leave the syringe on there. Now I'm going to secure the NG tube. And then we're going to hook this up to suction. It's going to be low intermittent suction. And we're done. To document, we're going to document where on the NG tube it is, which nares it was placed into, positive return of gastric contents, if any water or any input that was put into the NG tube, that it is hooked up, and the patient's positive response. That's it. Okay, we're going to irrigate the patient's NG tube. Got our tummy syringe, got a cup of water. We're going to draw up 30 mLs of water. Going to hook it up. Going to slowly inject 30 mLs. And we're going to draw back 30 mLs. If there's any difference, we would document the difference in the INO. And then we're going to document the positive response that and how much we injected and how much we were able to take out, and if there's any difference.